Now the next ENT surgery procedure we will discuss in this section is the myringotomy. We will talk about the indications of myringotomy and contraindications of myringotomy. What are the steps of the operation? And then we will talk about the pitfalls, post-operative care, and complications of the myringotomy. What is myringotomy? Otomy is the incision or opening. So myringotomy is the incision of tympanic membrane with purpose to drain suppurative or non-suppurative effusion of middle ear or to provide aeration in case of malfunctioning eustachian tube. So very common indication or the use of myringotomy is in the drainage of suppurative effusion or non-suppurative, which may be pussy or serous effusion that can be drained, which is usually present in case of otitis media, and also when there is a malfunctioning of eustachian tube, which is the tube that is responsible for maintaining the air pressure between the middle ear and the throat, that is malfunctioning or not properly functioning. We can put the tube for the maintaining of that aeration that is required. So that's the main purpose of myringotomy and what myringotomy is. Ventilation tube is inserted in case of the malfunctioning of the eustachian tube, which is the grommet. So here you can see this is the eardrum, and that's the normal middle ear in this case, and that's the middle ear with the fluid built up here. So that needs to be drain, and this is the blocked eustachian tube that needs to be corrected by the myringotomy. Next, the indications of the myringotomy. The indications are acute suppurative otitis media. Very common indication of myringotomy is the suppurative otitis media, middle ear infection with the formation of pus or abscess, which is known as suppurative otitis media. Severe earache with bulging tympanic membrane is present. Incomplete resolution with opaque drum and persistent conductive deafness. Complications of acute otitis media, for example, facial paralysis, labyrinthitis or meningitis with bulging tympanic membrane. So these are the complications of otitis media. We have facial paralysis, labyrinthitis or meningitis can occur. It needs to be treated, and myringotomy is performed, and incision is done in the tympanic membrane, and the abscess or suppurative effusion is drained. Another indication is serous otitis media, in which we have no suppuration, its serous effusion is present. Aero-otitis media is another indication, and then we have atelectic ear. All these are the conditions in which the myringotomy should be performed. Next, some contraindications. What are the conditions in which we cannot perform myringotomy? Suspected intratympanic glomus tumor. If there is glomus tumor is suspected in the tympanic membrane, we should not perform myringotomy. Cause profuse bleeding in case of glomus tumor, which is vascular tumor. Tympanotomy preferred. Now the steps of the operation are: the ear canal is cleaned of wax and any debris. Operation ideally performed under operating microscope using a sharp myringotome and a good suction apparatus. In acute suppurative otitis media, a circumferential incision is made in the postero-inferior quadrant of tympanic membrane, midway between handle of malleus and tympanic annulus, avoiding injury to incudostapedial joint. So this is in acute suppurative otitis media. And in serous media, what we should do, a small radial incision is given in the postero-inferior or antero-inferior quadrant, and all the effusion is sucked out. So there is a difference between the procedure performed for the suppurative otitis media and the serous otitis media. In suppurative otitis media, circumferential incision is made in the postero-inferior quadrant of tympanic membrane and to avoid injury to the incudostapedial joint, whereas in this case small radial incision is given. So these are the differences between the incisions given for the both types of otitis media. Now the pitfalls of myringotomy. When tympanic membrane is thick, so if the thick tympanic membrane is present, the incision is hard to give. So incision is given is hard to give in that the thick tympanic membrane. Incision may remain only in superficial layers of the drum head because of the thick tympanic membrane. Incision in the posterior meatal wall when distinction between the drum head and posterior meatal wall is lost and when both are inflamed. So these are the pitfalls of the myringotomy. Postoperative care and the complications of myringotomy, these are the ossicles or the bones present in the middle ear. We have the malleus. This is the handle of the malleus. This is the incus. This is the joint between the incus and the malleus known as incudo-malleolar joint. Then this is the incudostapedial joint. This is the stapes and this is the foot plate or the base of the stapes. Post-operative care and complications. Daily mopping of ear discharge in acute suppurative otitis media is important. In serous otitis media, leave a wad of cotton wool for 24 to 48 hours that keeps on draining the fluid. No water should be permitted to enter the ear for at least 1 week. Complications are injury to the incudostapedial joint or the stapes, injury to jugular bulb with profuse bleeding. If jugular bulb is high and floor of the middle ear is dehiscent. Middle ear infection can always occur if there is infection. If the incision is given for different conditions, then we can cause the middle ear infection. All these are the complications of the procedure, which is myringotomy. That concludes our section 2. Thank you for watching sqadia.com.